Good evening, everyone, and welcome. My name is Betsy Schneider. I am the director of the Summer Immersion program offered here at Wake Forest University. Thank you so much for spending part of your evening with us. We are thrilled to have students, families, and community partners joining us tonight as we explore three of our Summer Immersion program's most popular medicine-themed institutes: our Medicine Institute, led by Dr. Christina Rinaldi; our Sports Medicine Institute, led by Dr. Nick Traslini; and our Women's Health Institute, led by Dr. Una O'Neill. Tonight is all about helping you learn more about what makes these programs special. Our hands-on learning, behind-the-scenes access to Wake Forest School of Medicine and clinical spaces, and the outstanding faculty who lead each institute. Before we begin our panel discussion, I want to take a moment to thank our academic leaders for making time in their very busy schedules to be here. We are so grateful for your commitment to our students and for sharing your expertise tonight. Thank you, each of you. I'm going to dive in to some bios so that you all can get to know our academic leaders. One of the things that makes Wake Forest Summer Immersion program so special is that we hand select the individuals who lead our programs, and they are referred to as academic leaders. They are the faculty that teach our programs. And what makes our medicine-themed institutes incredibly special is we have, yes, they are faculty in the School of Medicine, but they are practicing clinicians. They are in the hospital serving patients, engaging with medical school students, mentoring residents, doing research. So we are incredibly fortunate to have our three academic leaders here with us tonight. First, I'm excited to introduce Dr. Christina Rinaldi, our academic leader for the Medicine Institute. Dr. Rinaldi is an assistant professor of general internal medicine at Atrium Health, Wake Forest Baptist, and a dedicated medical educator. She teaches both medical students and internal medicine residents and serves as a clinical skills coach for first and second year students. Originally, Dr. Rinaldi is from Sanibel Island, Florida. She completed her undergraduate degree at Florida State University and her medical degree at the Philadelphia College of Osteopathic Medicine. She then completed her internal medicine residency and chief residency at Wake Forest. She is passionate about caring for patients in both hospital and clinical settings and mentoring the next generation of physicians. Thank you, Dr. Rinaldi, for being here. And this is Dr. Rinaldi's fourth summer serving as our academic leader for the Medicine Institute, and she is phenomenal. All right, Dr. Traslini, we'll go to his bio next. Dr. Nick Traslini is our academic leader for the Sports Medicine Institute. Dr. Traslini is an orthopedic surgeon specializing in sports medicine, minimally invasive arthroscopy, and injuries of the knee, shoulder, elbow, and hip. He completed his residency at USC's Keck Medical Center, where he served as an administrative chief resident, followed by a sports medicine and shoulder surgery fellowship at Rush University Medical Center. He has cared for athletes at all levels, including serving as a team physician for the Chicago White Sox and DePaul University, and he currently supports Wake Forest University athletics and several local high schools. And fun fact, you can often see Dr. Traslini on the sidelines at Wake Forest football games, so go Deeks. Thanks for being here, Dr. Traslini. And finally, last but not least, we are joined by Dr. Una O'Neill, academic leader for our new Women's Health Institute. We are in year 2 of offering our Women's Health Institute, which is incredibly exciting. Dr. O'Neill is an OBGYN at Atrium Health, Wake Forest Baptist, and an advocate for comprehensive women's health care. She specializes in obstetrics, gynecology, minimally invasive surgery, menstrual disorders, contraception, and menopause care. Dr. O'Neill earned her bachelor's degree in molecular biology from Lehigh University and completed her medical degree at MCP Hahnemann School of Medicine. She then completed her OBGYN residency and served as chief resident at Christiana Care Health System before joining Wake Forest Baptist Hospital. She teaches and mentors medical students and residents and is passionate about empowering the next generation to understand and advance women's health. We are so thrilled to have each of you with us tonight. We are now going to dive into a series of questions that will give students and families a closer look at what they can expect inside each of our medicine themed institutes. I also want to preface that this is being recorded. So for those family members or educators or students who may not have been able to join us tonight, we know it's a very busy time of year. This will be recorded and will be posted on our YouTube channel as well. So let's dive into our questions. So I'm going to start with you, Dr. Rinaldi. Our first question is more about you individually as a person. So can you share a little bit about your background and what inspired you to pursue your specialty?
Yeah, sure. And thank you for the introduction. And welcome to all of you for joining us this evening. Yeah, so my background, it was one of the things where I always wanted to actually be a dentist. And so during undergrad, when I was exploring kind of the different committees and groups that you can be a part of, I decided that was definitely not for me. And then I went the more medicine route and just kind of stuck with that. Got through medical school, and during med school is when you get to explore the different areas. And it was just one of those things where what feels right for you. And for me, that was internal medicine. It just clicked. I felt like it was the right decision. And it leaves opportunity to kind of explore other areas of medicine, the ability to specialize kind of as you progress in your career. So for me, that was kind of what drew me into internal medicine, and then just being able to take care of the whole body and kind of explore all the different areas of medicine within internal medicine specifically.
Thank you for sharing that, Dr. Rinaldi. Dr. Traslini, let's go to you next. What inspired you to pursue your specialty?
Yeah, so I practice orthopedics and sports medicine, and throughout my childhood, athletics was kind of my main thing. I was really interested in sports, and I was unfortunately a frequently injured athlete, so I had a lot of exposure to orthopedic surgeons and sports medicine and athletic trainers and physical therapists and all those aspects of sports medicine. When I kind of matured into high school and then college, I developed an interest in physics and engineering, and I had an engineering degree at the end of all of that. But I found that orthopedics was a great way to synthesize all my interests with physics, engineering, sort of a hands-on profession, and then also with my interest in athletics and sports participation. And so now I get to participate in athletics on the sidelines, caring for athletes as they get injured at the time of play. And I participate in that with the Wake Forest football team. But I also get to do that engineering and physics thinking along with my surgical planning and really fixing mechanical problems of the body. So that's how I got here. Thanks for having me.
Thanks, Dr. Traslini. And Dr. O'Neill, tell us a little bit about what inspired you to pursue your specialty.
This is one of my favorite questions, especially to answer to high school students who are considering anything in medicine. So I grew up, I played sports. I thought I wanted to be Dr. Traslini. And back then, this is 30 years ago, we didn't shadow and we didn't have experiences like what Wake Forest is providing to show us what the field of medicine is really like and what it's like to practice medicine. So I was a third-year medical student thinking I was going to go into orthopedic surgery. And it wasn't until that clinical rotation you do in your third year of medical school where I actually saw what orthopedic surgery was. And I hated it. That was the last thing I wanted to do. I was not a physics person. I was not an engineering person. And I didn't realize that until I really saw what that meant in medicine. My next rotation was OBGYN, which was the last thing I thought I'd be interested in doing. And I absolutely fell in love with it. And it just kind of felt like a calling. And there was nothing else I loved as much. I call it my first love, quite honestly. And that's how it came to be.
Thank you so much for sharing that, each of you. And I think kind of what I'm gathering from all of your different stories and all of your different journeys is that no journey is linear. You can't kind of plan out your life. You never really know what exactly is going to happen. And I think the summer immersion program is such a great way to kind of test the waters and explore your curiosities in the field of medicine. And sometimes our students decide, hey, medicine isn't for me, but that's part of the beauty of being able to test and explore and ask questions. during this time in your life. So thank you for speaking about each of your inspirations and kind of what led you to where you are today. We are now going to dive into questions about the institutes themselves. So we will kind of pass it back and forth, talking about the Medicine Institute, which is our general medicine themed institute, and then also our Sports Medicine Institute, which is more specialized, as well as our Women's Health Institute, which is a little bit more specialized. So we'll start with you, Dr. Rinaldi, for this, or no, Dr. Traslini. We're actually going to start with you for this one. So our next question is, and we get asked this question all the time. So it's wonderful that our students and our families and our educators and counselors get to hear it straight from your mouths. What types of hands-on activities or medical skills will students get to practice during your institute?
Yeah, that's a great question. And we do try to find a lot of balance between sort of classroom learning and then hands-on learning. We understand that you all are giving up a week of your summer. We don't want you sitting in the classroom the whole week. And so we really work hard to find hands-on activities. So in the Sports Medicine Institute, there's a few things that we do. One is that we go to the Wake Forest pitching lab, which is for Wake Forest baseball. A big part of what makes our team so good is the biomechanical analysis of the throwing athlete. And so you'll be able to see that hands-on, and even some of the students are able to throw and see what their body looks on that biomechanical analysis. We also have a casting workshop where you get to put casts on one another and practice doing that. And then we have a series of skill sets with athletic training where we have ankle taping and some ultrasound related activities. So there's a hands-on skilled session there. And then really the cornerstone of the week is our cadaver lab experience, where you do get a hands-on experience in a cadaver lab with knee and shoulder and elbow and hand anatomy. You get to see how the body works. We also have students try arthroscopy on a real knee, and that's just a very unique experience for the high school level.
Yeah, absolutely. Sports medicine students are kind of going from the hospital to Wake Athletics behind the scenes to the pitching lab, as Dr. Traslini mentioned. So students are really able to see what the clinical or surgical setting might look like, and also kind of witness hands-on activities as they pertain to being on the field, or being, in a research setting, kind of learning about the biomechanics of things. So it's very cool because students can kind of wear different hats, so to speak, in the sports medicine world to kind of see which aspect of sports medicine interests them most. Dr. O'Neill, I'll pass it to you next. What are some of the hands-on activities or medical skills, or things that students could look forward to in the Women's Health Institute?
Yeah, I think what is very unique about women's health and what most people don't realize is how much surgery and procedurally we do with our hands. Everybody, when you think about a general OBGYN, you think about delivering babies. And yes, that is definitely a big part of what we do. So day one, you're on our labor and delivery unit. You see the different birthing types of rooms. You also see our NICU, which is the neonatal intensive care unit, which is where newborn babies go if they have special monitoring that they need. You see our postpartum unit. But then half of what we do is also surgery. And so we have laparoscopic skills stations where you do simulation of surgeries, as well as a simulation of a vaginal delivery. For privacy reasons, we can't have our high school students delivering real live babies. We're not quite there yet. So we have a simulation experience for all of those experiences. But yeah, very hands-on, because that's a big part of what we do.
Yeah, thank you so much for sharing that, Dr. O'Neill. That is definitely one of the students' favorite things, is being able to deliver a baby from a mannequin. So it's a robotic mannequin that students get to deliver the baby with, but it's very, very cool, and it's always a highlight of the week. So thank you for sharing all of those amazing things that students get to experience. Dr. Rinaldi, we'll pass it to you. What types of hands-on activities or medical skills will students get to practice during the Medicine Institute?
Yeah, so the way we kind of have planned out the whole week is that most of your time is going to be in the medical school setting, and then part of the time will also be in the hospital. But a lot of the goals are that we're really having our students explore and experience a lot of what I do with my medical students. And so similar to what Dr. O'Neill was mentioning with like birthing simulations, we'll definitely have a whole day dedicated to like simulation stations. Some of them will be like performing chest compressions, like how to life support, like what do you do when someone's heart stops or they stop breathing, like how do you respond? How do you intubate and put a breathing tube in someone that can't breathe on their own? Similarly, it's all through simulations, not on real people. So that's just an example of one day. And then other things would be like suturing, some basic skills like that, how to put in using ultrasound is a large part of the week as well, how to use an ultrasound, why we use ultrasound. So we actually get to practice using ultrasound as well, putting in IVs. And then also just learning the basic skills within medicine. So a little less specialized as Dr. O'Neill or Dr. Traslini, but just how to listen to the heart. Like how do we teach our medical students to listen to the heart? Why do we listen in the places we do? What are we listening for? Same thing with lung sounds. And then at the end of the week, you get to kind of put it all together, all of your skills, and then actually practice in small groups on standardized patients, pretending to be patients with cases where you're doing a physical exam, taking a history, trying to come up with differential diagnoses of what could be going on with your patient.
Thank you, Dr. Rinaldi. Yeah, that is the coolest part of the week. So at the end, the standardized students actually go into exam rooms and get to examine standardized patients who are actors. But it is very cool seeing the students kind of gain confidence throughout the week. And then by Friday, they have to kind of put on their white coat and, do a physical exam and introduce themselves. So that's very, very cool. I do want to preface, I think, all of our hands-on activities are so, so fun and so exciting and really enlightening. But there also is a lecture component to our medicine-themed institutes. Dr. Traslini, Dr. O'Neill, and Dr. Rinaldi will tell all of our students, medical students in their first couple of years, a lot of how they learn is through lecture. So, of course, we want to highlight all of our hands-on activities, and those are the most important and exciting parts of our program. But of course, we also want you to learn something. So there always is going to be a few presentations and a few lectures so that students walk away with some good core knowledge of each of the institutes. So I also just want to say that students with our hands-on activities gain remarkable access. So students are getting to practice skills and experiences that many medical students don't encounter until their third year. So it is an incredible opportunity to test the waters and see what practicing medicine actually feels like. And I think that is one of the most unique parts of each of our institutes is just the access that students are able to have when they are able to do all of these amazing things. All right, we will transition on to our next question. And Dr. O'Neill, we're going to start with you this time. Students love the behind the scenes elements of being able to be in the School of Medicine, in the hospital, wherever else they are able to go. So will students have the opportunity to go behind the scenes in the hospital, in the School of Medicine, or anywhere else during the Women's Health Institute?
Yeah, that's probably the cornerstone of the Women's Health Institute. Even from day one, hour one, we're literally on labor and delivery. And so everything is, I think half of what we do is in the hospital, walking the hospital alongside of me and my residents, and half of what we do is at the School of Medicine. So you're going to be in the simulation labs that are downtown. You'll be in our lecture halls that are there. You're going to really be walking the shoes of a medical student and a resident. And you'll meet our medical students and our residents as well in that process. And so the behind the scenes is we are literally transplanting you into that hospital and medical environment so you can really get a sense of what that feels like.
Yeah, thank you so much for sharing that. That is one of my favorite days, day one of the Women's Health Institute on labor and delivery in the NICU, kind of seeing where Dr. O'Neill does surgery was pretty incredible. And it's a lot for our group of students to be in the hospital in patient-facing areas. So we always remind our students, we kind of have a really good discussion, like we are going to be encountering people in a hospital. We have to act like medical students and medical professionals when we are engaging in hospital settings, especially when we would see patients and families. Um, so thanks for sharing that, Dr. O'Neill. Dr. Rinaldi, what behind the scenes opportunities will students have during the Medicine Institute? Talk us through kind of where the Medicine Institute is based and all that students get to see.
Yeah, so the majority of the time for our week is spent in the medical school itself, in the classrooms that the med students are typically learning in. And so they'll have the opportunity to kind of explore the areas of the medical school, being given a tour by the medical students, meeting the med students. So they'll be able to see all those different spaces, the cadaver lab. And then we will have also some time in the hospital as well. So prior to the med school moving out of the hospital, it used to be inside the hospital. And so we actually use some of that space in the hospital where they're actually in those kind of lecture halls, auditoriums, learning, and then also going into the hospital to a lot of different areas to explore kind of, I don't want to give it all away, but there's a lot of different specialties within the hospital we get to explore, and we're in patient-facing areas. And that's usually one of our favorite days of the week.
Yeah, thanks for sharing that, Christina. And you can share a few examples of the different places.
Yeah.
Everything is always subject to change, but what are some of the different locations in the hospital that we visited in the past?
Yeah, so I think one of the favorites is usually we go to the cardiac cath lab. So if you're not familiar with that is where they're actually doing procedures. If someone comes in with a heart attack and there's a blockage of a blood vessel leading to the heart, right? They can actually see sometimes. We have a separate room we're in to practice, and they actually go on the table and not actually practicing, but kind of modeling what it would be like with all the different catheters and stents that you would use to open up the blood vessels. But we are actually in those spaces where they have procedures going on in the background. So we've had students see, live procedures, open heart procedures, things that you might not exactly expect. But that's definitely one of the areas that the students love the most.
Great. Thanks for sharing that, Dr. Rinaldi. Dr. Traslini, what about you? What are your favorite behind the scenes opportunities that students get to kind of witness and be a part of during Sports Medicine Week?
Yeah, some of the behind the scenes opportunities include we have a tour of one of our clinics where we do some stations and interact with athletic trainers, but also with some of our primary care sports medicine colleagues. And then we have an experience at Wake Forest University where you get to see sort of where the athletic training headquarters is at Wake Forest and get a tour of the athletic facilities, including kind of behind the scenes of the football athletic facility and the basketball athletic facility, and really some of those cool, updated, new and expensive, shiny facilities that Wake Forest has invested in over the past 10 years or so. So in addition to the pitching lab, which I discussed, those are kind of the other field trips, so to speak, where you get to see behind the scenes.
Mm-hmm. And the Sports Medicine Week is spent entirely, except for those athletic days, in the hospital. So that is kind of the students will be in the hospital throughout the course of the week for the Sports Medicine Institute as well. Well, thank you all for sharing all of those kind of behind the scenes special opportunities and elements of each of your weeks. One of the things that students always tell us is how surprised they are to discover spaces in the hospital, the School of Medicine, that they never knew existed. So our simulation centers, specialized procedure rooms, training labs, and other areas that many undergraduate Wake Forest students never even get to see. So those experiences really open their eyes to the depth and variety of medical training that exists across all of your specialties. So with that in mind, let's move on to our next question, which focuses on the incredible medical professionals and guest presenters that students get to meet throughout the week. So, Dr. Rinaldi, we'll start with you. So, guest speakers and guest presenters and kind of specialists that come in and share their time with students are such a huge part of our institutes. Who are some of the medical professionals that students get to meet during the Medicine Institute, and what will they learn from them?
Yeah. So I think when people think Medicine Institute, and a lot of the students too, they come into it being like, I want to be a doctor, right? And that's great. I support that. We're all doctors, great. But there's a lot of different specialties or tracks you can take into medicine that's not necessarily becoming a doctor. So I think it's really important for the students to be able to learn about all those different tracks that you can take, starting even preparing in college. And so a few of those are like certified registered nurse anesthetist, so kind of seeing the other side of anesthesiology path that you could take, learning about the different careers within nursing itself is a really great opportunity as well, that I feel like some people don't realize that there's a lot of opportunities within nursing, not just being a nurse like in the hospital, but with that degree you can do a lot of different things as well. PAs, so you'll also have the opportunity to meet PAs, students, do some activities within the PA school itself. And yeah, and then obviously medical students as well. So, and then I have my residents sometimes volunteer. So you kind of get to see the different paths that you could take within all the areas of medicine.
Yeah, thanks for sharing that, Dr. Rinaldi. One of the really cool things with the Medicine Institute is we have Pathways to Medicine Lunch and Learns, where students are able to kind of engage with all of those different career pathways that Dr. Rinaldi just mentioned. So, the day is jam-packed, and then you also get to kind of integrate and engage with other types of professionals outside of the, as Dr. Rinaldi mentioned, the MD track. Dr. Traslini, can you talk us through some of the medical professionals that students get to meet during the Sports Medicine Institute?
Yeah, I would totally echo a lot of what Dr. Rinaldi said, which is that there's a lot of different ways to be in medicine, and they don't all have to be through an MD, DO, doctor track, so to speak. And what we like to say in sports medicine is that sports medicine is a team sport. And one of my goals with the Institute is to introduce the students to all different options and careers within sports medicine. And really, we start the week with an introduction to sports medicine that talks about all the different professionals that contribute to the care of athletes or active individuals and really what makes up sports medicine. And so we have talks and presentations and panel discussions from medical students. We have occasional participation from residents. We have PAs. We have physical therapists. We have athletic trainers, many athletic trainers. We have an orthotist, someone who makes prosthetics and those types of things. We have a cast technician, someone whose job is to just make casts. We have a nurse practitioner. So we've really tried to present a very diverse group of professionals and career paths, which might be a better fit for somebody than the medical doctor track. So I think it's important for students at this early stage of learning to really experience a broad breadth of different career options so they can explore them and really find what might be the best fit for them and their life goals.
Awesome. Yes, we agree. And Dr. O'Neill, who are some of the medical professionals that students will meet during
Yeah, there is a bombardment of all the different subspecialties in women's health because women's health is such an umbrella term. And like Dr. Rinaldi and Dr. Traslini said, we have all different types of people in medicine who are not necessarily all doctors. But what's unique to women's health is outside of the general obstetrician and gynecologists, you also have subset fields like high risk obstetrics. You've got certified nurse midwives that you'll meet. You've got lactation consultants that you'll meet, as well as the other specialties like minimally invasive surgery, advanced pelvic surgery, gynecologic oncology, infertility. There's just so much more within the realm of women's health that we actually have guest speakers and different activities that represent all of these fields. So you really get a good exposure to everything that is available in women's health. And whether you pursue that as a doctor or in some other level in those fields, I mean, the sky's the limit, but you have to at least know what's out there.
Yeah, I honestly think that is one of the most valuable things that we showcase throughout each of these institutes is just how the variety of professionals that you can envision in the healthcare field. So thank you for highlighting the incredible professionals that students get to learn from. One of the things that we hear every year, year after year from students is how meaningful those interactions are and how those light bulb moments, truly are happening throughout the week when all of a sudden a student is inspired by one of these professions that they may never have considered or never have known about. So, and also that students tell us that a single conversation with a resident or a specialist or a physician they met throughout the week changed the way they think about medicine or their future. So it's so important that students are able to engage and kind of envision themselves in all of these different shoes so that they can kind of clarify their goals as they move forward in life. We also ask that students write thank you notes to all of these people who are coming and joining us for our medicine themed institute. So students will have the opportunity to not only meet and engage and ask questions, they'll also have the opportunity to write a thank you note and hopefully keep in touch with some of the people that they get to meet. Building on this idea of connection, our next question focuses on mentorship and the relationships that students can form throughout the week during our medicine themed institute. So, Dr. O'Neill, a key part of this experience is building connections. How does your institute help students connect with medical students, residents, or other faculty members?
Yeah, so I think with the Women's Health Institute, we have so many different people helping with all the different activities that we have, from medical students to residents to my fellow colleagues, attending physicians and nurses. And you have direct access to all of those people because you're working hand in hand right next to them with whatever we have that we're doing. Emails are exchanged if so desired. Cell phones are exchanged. I mean, that's what we experienced last summer. And it's a very relaxed environment where all questions are asked. And, coming from our perspective, we understand medicine has evolved so much that there's a little bit of like, you don't know what you don't know yet. And so we really want to just engage with people and see where you're coming from and see what you know. And so I've still been emailing with some of my students from last summer who continue to have experiences or questions. And that's just kind of been our culture.
Yeah, thanks so much for sharing that. Dr. Rinaldi, can you kind of speak to the experience in the Medicine Institute of building connections and mentorship opportunities and things like that?
Yeah. So I think similar to what Dr. O'Neill said, the students will be able to learn from and meet so many different people throughout the week, including medical students, residents, other attending faculty. And so I think just through those experiences where you're exchanging emails, that's a way to be able to build mentorship. And I think specifically for myself as well, I mean, I've had a lot of students that have kept in touch with me, similar to Dr. what O'Neill said. And then I've had students that when they have certain questions for me, they'll reach out to me afterwards or during the interview, and I don't necessarily maybe know the exact answer. I've connected them via email with some of my medical students that I work with all the time, because sometimes they feel like they're a little bit closer in training and schooling. And so sometimes I think that's really helpful too, to be able to learn from peers that might be a little bit closer to where you are.
Yeah, that's great advice. And Dr. Traslini, how does your institute help students connect with mentors or other professionals?
Yeah, I would echo a lot of what was said already, but just a couple additional points. We've had students who reached out for letters of recommendation based on their time or exposure during the summer immersion week. We've had students, at least ones that were local, come back and shadow in the clinic afterwards, just to kind of expand their experience or exposure. We certainly make ourselves available for any questions afterwards and any correspondence afterwards. I've had students that reached out trying to get connected to shadowing opportunities in the place that they come from or the place that they live, and we've helped facilitate that with colleagues in the region. So there's a lot of opportunity to connect, explore, and really develop those mentorship pipelines.
Yeah, thank you all not only for answering that question so well, but also just for your continued correspondence with the students who reach out to you and building those connections, because those, as we know, are so invaluable and really, really crucial as you kind of discover who you are. Mentors are such an important part of growing and discovering who you are. Um, I also want to share a quick piece of advice before we move on and open up the floor to questions from our audience. Um, you will come, if you do come to Wake Forest and you join the Medicine Institute or Sports Medicine or Women's Health Institute, what I would tell you is it is time to step out of your comfort zone and it is time to ask all of the burning questions that you may have about medicine or healthcare, or pursuing your dream in any way, shape, or form. Um, the learning environment is really enriched when students come ready to engage, ask questions, put themselves out there. Um, we don't want students to come to our institutes and just sit. We really want students who are excited about learning and engaging with the people who are giving their time to these programs. So, if you do come for one of our institutes, squeeze every opportunity out of this experience, because that is what really makes it, is your questions, your engagement, your willingness to be the first student to ask the first question. It's always like kind of like a domino effect. If we have one student who's super excited and engaged, that kind of bleeds into the rest of the group. And it really makes it a really great experience if you're willing to ask those questions, introduce yourselves to those professionals, kind of put yourself out there. So I encourage you all to do that if you end up coming to Wake Forest. Um, Thank you all so much for sharing those insights about mentorship. We consistently hear from our students about how important mentorship is and how those connections last well after the program ends. We are now going to transition and kind of move on to something a bit more personal before we dive into our audience questions. So many of the students joining us tonight are just beginning to explore medicine or thinking about health-related fields. So our final question is about the advice that you would offer them as they take their first steps kind of on their professional journeys. So what advice do you have for high school students beginning to explore medicine or health-related careers? And Dr. Traslini, we'll start with you for this one.
Yeah, I think we're living in a time where everybody's harder and harder to differentiate on paper. And I think what really differentiates people now is the breadth of their experiences. And so exposing yourself to different careers, shadowing, experiences like the summer immersion program, not only do they help you grow individually, may help you identify more specific interests or may help you solidify certain interests, may help you turn you away from things you thought you might have been interested that you're not interested in. But also really strengthen your application as you apply for college and then eventually medical school, just to show that you have really invested time and energy in diversifying your experience, increasing your exposure to these fields of medicine.
Great. Yeah, that's really wonderful advice. Dr. Rinaldi, what would you say? What advice do you have for high school students beginning to explore medicine?
Yeah, I think I have a similar answer because I think the most important thing is just getting that real life experience, firsthand shadowing. I know for me, like when I was in undergrad, that's when I first started kind of exploring medicine via, the different groups, organizations, committees in undergrad, where they have different opportunities where you can volunteer and get experience that way. And then also just reaching out to people you might know that are in the field that you're interested in. I think that's the only way truly to know if that's a good fit for you, is firsthand working with it, seeing what that life looks like, and getting out of your comfort zone. Like for me, like shadowing in undergrad, I was very uncomfortable doing exactly what I'm doing now as a career. Like shadowing those people like made me very uncomfortable, but it was through that experience that I kind of developed and learned like what I enjoyed about it and kind of developed that passion to where I am now.
Yeah, that's great. Whether you're interested in medicine or not, getting out of your comfort zone and growing by getting a little uncomfortable is really, really great advice. Dr. O'Neill, what would you say? What advice do you have for high school students beginning to explore their next steps?
Yeah, I think not to repeat what everybody else has said, I'll say two kind of other thoughts. Number one, you have to be true to yourself. And so be very open-minded, because what you think you know about medicine, you will absolutely be surprised at what you learn. Think about, like, I thought I was going to be an orthopedic surgeon and I completely changed career paths. And so you kind of don't know until you ask enough questions. And not only with shadowing, because you can't shadow every single kind of doctor out there, that's too overwhelming, but talk to as many people as you can. Ask questions about what their life is like, what their career is like, and really get down to the nuts and bolts. Medicine has changed so much. If anybody has family or friends who are doctors, the medical system and our reality is different from what it was when they went through it. So you need to talk to people who are in it now, to really find out what is it like to be an obstetrician today versus talking to people who are talking about it from 30 or 40 years ago. It's a completely different thing. So I would say talk to as many people as you possibly can, and learn about careers that way too.
Awesome. Well, thank you all so much for that thoughtful and valuable advice. It is such a gift for our students to hear directly from medical professionals and our academic leaders who have such diverse paths and a shared passion for paying it forward and leading our summer immersion program medicine themed institute. So your insights and just being able to chat with you tonight are helping to demystify the journey into medicine and what, is always portrayed in the media, and helps to give our students and our families a clear sense of what's possible for them in their next steps. So with that, we would love to open the floor to questions from our students and families. So now is the time, if you haven't yet, put in chat questions specific to the Medicine Institute or sports medicine or women's health. Now is your time to kind of get into the nitty gritty, like ask your questions. You have our leaders right here, who are here to and happy to answer your questions. So click on that Q&A box in the bottom of your screen, and I will direct your questions to our academic leaders. All right. So our first question is, how many students are accepted within each of our institutes? So I can kind of speak to that, and then I will kind of let each of our academic leaders talk about how we are split up into groups for different scenarios and things like that. So for women's health, we have 30 students in a cohort, and for medicine and sports medicine, we have 50 students in a cohort. Medicine and sports medicine are offered 2 weeks, and women's health is offered 1 week. And I will also say that our medicine themed institutes are the first to fill. So the reason we're having this webinar around the holidays is because our medicine institute, our sports medicine, and our women's health institutes are probably going to fill soon. So with that, that's some background on each of our medicine cohorts and how large they are. But Dr. Rinaldi, why don't you kick us off and kind of talk to just being able to handle 50 students in a cohort and what we do to make sure that everyone kind of gets access.
Yeah, so obviously when you think about 50 students in a group, that's a lot of students. But we do our best with basically every single activity we're in on breaking you into small groups. So that way you kind of have that opportunity to kind of work as a team, have everyone have a role within the small group. Everyone's able to participate, and kind of give it that kind of smaller group feel, obviously, rather than being in a large group. And now I feel like, personally, if you're in front of 50 people, it's harder to speak up and ask questions, right? You might be more fearful of doing that. But I think that also gives the opportunity, because everyone's different, to kind of build that confidence and feel like you can ask questions freely and not be judged and be in a safe space.
Yeah, thanks for sharing that. And I would say that's pretty similar, Dr. Traslini, to sports medicine as well. Do you have anything to add?
I would just echo a lot of what was said already there.
Okay, great. Dr. O'Neill, any insights about the size of the group for women's health?
Yeah, we're a little bit smaller because the hands-on things that we do and the fact that we're real time on labor and delivery, we can't have a very, very large group all at once. So we split everybody up into groups of 10. And so when we're teaching suturing, we can manage 10 people and teach them well. So we actually took less students just to have a more quality experience.
Great. Well, thank you for sharing all of that. That was kind of a logistical question. So this is a good question. What does a typical day look like for each of your institutes? So Dr. Traslini, I'll pass it to you to kind of do what a typical day looks like. Each of our programs the academic day runs Monday through Thursday, 9 a.m. to 4:30 p.m., and then Friday is a half day, 9 to 12 noon. So it's about 4.5 days of academic programming. So with that, I'll pass it to you, Dr. T. You can
Yeah.
share what a typical day in the Sports Medicine Institute is like.
Yeah, so every day is a little bit different, and we want to do that on purpose so people don't get bored. But typically, you're in the classroom setting for about half the day, where we have lectures from orthopedic surgeons, podiatrists, physical therapists, athletic trainers. We have panel discussions. Some are more interactive, some are more sort of slideshows. We have a lot of video content, pictures, things to keep you involved. And then half the day is typically some sort of activity. And I've mentioned some of them, whether it's a cadaver lab experience, we do have suturing, we have a casting workshop, we have an athletic training workshop with some physical activity and also some things like ankle taping. We have our field trips to Wake Forest. So typically you can expect to be in a classroom setting for half the day or roughly half the day, and then doing some sort of activity, whether it's a field trip or hands-on activity for the other part of the day.
Great. Dr. Rinaldi, do you want to kind of talk through what a typical day in the Medicine Institute looks like?
Yeah. So every day is going to be a little bit different, obviously. Most of those days we're in the med school other than the one day that we're in the hospital. But yeah, I think that we break down, a lot of the days are kind of broken into half days, and within those half day sessions, it's a lot of small group activities rotating through different stations. And so we try to have like a theme for each day as well, which isn't perfect, but we try to make it a theme. So like that first day, for example, that whole morning is going to be spent in small groups rotating through different kind of EMT trauma experiences, like resuscitation, if someone's bleeding, that sort of thing, in small groups with some retired EMTs and some of our volunteers. And then, yeah, then you have your lunch panel sessions that we talked about. So each day has a theme for a pathway to healthcare lunch. So we talked about like PA, nurses, CRNAs, med students. And then, yeah, so I think that's just like kind of like a flavor of like the different activities that we'll have in each day. And limited lecturing, but like Betsy already said, there's going to be a little bit of lectures built in so that way you have that kind of foundational knowledge about what you're learning and then applying physical exam skills too.
Great. And Dr. O'Neill, do you want to share what a typical day in women's health looks like?
Very much the same, half and half between activities and lectures. Our lectures are very interactive. There's lots of questions. Last year, our students, we were talking during our lectures. It wasn't just us with a PowerPoint presentation, just talking at you. There was a lot of back and forth, and that's what the lectures feel like. I think our Monday is a little bit more procedural heavy, just because coordinating labor and delivery and all the different places we go. Thursday is more sitting and listening and talking interactive heavy with the way that it breaks down. But I would say half and half in general.
Yeah, great. Thank you all for sharing all of that. And then I would just add, you are living in Wake Forest University residence halls. You'll eat breakfast in our dining hall known as the Pit. We'll transport you to either the School of Medicine or the hospital or wherever it is you might be. And then typically we have teaching assistants who are Wake Forest undergraduate students, typically interested in pursuing pre-med or becoming physicians or healthcare professionals themselves. They are leading an icebreaker so that you get to know your group of students in the cohort with you. And then, you'll get to hear and see what all of our academic leaders just shared. We usually have a catered lunch. I know meals are important to all of you, so we'll typically get a catered lunch, and then you'll be transported back to Wake Forest's campus after programming concludes. And then you have downtime. So that was a question we received. You do have downtime. You get to kind of rest and relax and rejuvenate after our academic day ends. We offer evening activities that are optional. So if you want to do something in the evening, you can. But it's also just time to kind of relax and reflect on all of the amazing opportunities you had that day. This is a question for you, Dr. Traslini. If someone's interested in sports medicine, but not becoming a physician, but more like an athletic trainer, is this program right for them?
I was just typing my response, so I'm glad you did it out loud. Yeah, I think this is the perfect program for that person. And we really do like when there's diverse interests in the group where, not everybody wants to be a doctor. And we've always had a group that likes to be or interested in being athletic trainer. We've had people within the group often interested in physical therapy. And having that diverse set of interests is really nice because we do have all these people speaking, and it's nice when people are interested in those professions specifically. We also have some panels that are very comparative, so where we have like PA, PT, athletic trainers all on the same panel, so you can ask those questions and compare and contrast those careers. So I think if you're interested in athletic training, it's a really good institute for you.
Absolutely. Dr. Rinaldi, does the General Medicine Institute also have a cadaver lab experience?
So we have in the past had cadaver lab anatomy involved in it. For this year, we've actually adjusted that to include different sessions based on feedback from prior years. So every summer, we go through all the students' feedback and try to make sure we're highlighting all the things that were really loved, and the things that maybe weren't as exciting or didn't have as much interest. We try to switch things out to make it fresh each summer. So we did switch out some of our cadaver experiences for this next summer. But similarly, you will get to experience kind of in the medical school where the cadaver lab is, where they do their anatomy sessions typically as medical students and that sort of thing.
Great. Yes. Thank you for sharing. And every year is different. Every summer is different. When you're working with our medicine institutes, you never know who's available to come and speak or present, or what specialists may be able to volunteer their time, so it changes every year. So we always are trying to incorporate, making each of our institutes really hands-on and really exciting. But as we mentioned earlier, everything is kind of subject to change. This is a good question. Will we learn clinical decision-making skills in each of the institutes? So, Dr. O'Neill, I'll give that one to you.
You will, just because when you're delivering a baby, there's a lot of clinical decisions you have to make. We also expose you to, when we're doing our laparoscopic skills training, decisions you might make when you're operating inside the abdomen or the pelvis of somebody. So very clinically oriented, and you see kind of, okay, as a surgeon, this is kind of what needs to be going through my head at the time, in addition to using my hands and having the skills to do whatever my head is telling me to do. So in that respect, yes, there is a lot of clinical decision making. There's also a lot of conversation and debate with, current topics in women's health, where you're learning what the thought process is. For example, when women have to go through the process of figuring out what contraceptive they want, the do's and don'ts, the why nots of all your different options. So you'll go through kind of what that process feels like as a clinician.
Great. Yeah. Thank you for sharing that. Do you want to add anything, Dr. Rinaldi or Dr. Traslini, about, thought process or clinical decision making throughout the institute?
Yeah, I was going to say we have a whole half day where we created these medical cases. There's 6 medical cases, and it's actually set up in a way that's very similar to small group learning that a lot of medical schools have taken on that style of teaching. So within your small groups, but I didn't want it to be school. You know what I mean? Like I still was like, this needs to be fun and exciting and collaborative and make you think and have fun at the same time. And so I try to be very thoughtful about all of that with all the cases. And so we actually will have like props for every part of the case that you would need. And then you have to work together to put the case together and then come up with a final diagnosis of what you think is going on with your patient. So that's a fun session that we have with the PA students for a half day.
Yeah, absolutely. And Dr. Traslini, I know there's a lot of decision making that goes into deciding whether or not to do surgery. So talk us through kind of how students are prepared for those types of decisions during your institute.
Yeah, unlike the Medicine Institute, we don't have that dedicated session. It's a great idea. Maybe that's something we could add in the future. Um, but we do have a lot of lecture content that tells you about different orthopedic conditions and ways you diagnose and treat them. And so that's our contribution there.
Great. Um, this is a good question that was submitted to us. In addition to learning about medicine, will the institutes cover the psychological and social factors that impact outcomes on patients? So, Dr. O'Neill, I'll start with you for that one, and then we can pass it on.
Yes, there's a lot of that in women's health. And we actually have a specific session. It was Wednesday afternoon last summer, talking about ethics and social determinants of health and all the other social factors that go into healthcare decisions, particularly with women's health. So there's quite a piece on that for sure.
Great. Dr. Rinaldi, do you want to share anything about the psychological and social factors that students learn about during medicine?
Yeah, one I want to say it's a great question. But yeah, absolutely. And I think the first thing that comes to my mind when I think about like our medicine week is when we're in the hospital specifically, and when we're in all the different areas of the hospital. So whether that's seeing patients getting dialysis, right, when their kidneys aren't working, you need dialysis, or if you're in the cardiac cath lab seeing patients that, you know, are having a heart attack. I think that's a great way that we incorporate kind of explaining like what these things are, why these patients might be in the situation that they're in, and how every patient is so unique and different in terms of how they receive care, the receive that we can give them. And that's just such an important part of our ability to treat patients. And so definitely we try to incorporate that.
Great. And Dr. Traslini, anything else to add for sports med?
Not as much sad for sports med.
All right, so I think we are about wrapping up. So it's 8:58. So thank all of you for joining. We're going to do one more question. This is a great question. It's a good final question. So this was submitted to us. What is your favorite part about the institute that you lead? Dr. O'Neill, we'll start with you.
Hands down, it is selfishly, it's what I learned from the students. So my high school students last year brought such new perspectives to me that just made me use my brain in a different way that I hadn't. And that's selfish. I mean, that's what I gained out of it. And that's my favorite part of it, is seeing your perspective on life today, on health today, what your questions are about women's health today, is a lot of fun for me.
That was a great answer. Dr. Rinaldi, what would you say?
Definitely the students. They're just so fun. I think we all work with learners in different capacities. So I work with medical students, I work with residents in every single aspect of my job. And so to be able to work with like high school students too is like just super fun for me. Just the energy that they bring. But also, I got too excited and I forgot. I had a really good point I was going to make. Dr. Traslini, you say what you're going to say and then I'll think of my other part.
Yeah, I was going to say that my favorite part is watching the group kind of coalesce over the course of the week. And in the beginning, everybody's very afraid to ask questions and bashful. And by the end, they're like really all friends with each other. There's really no fear to raise your hand and ask a question or participate. And it just becomes a lot more fun by the end of the week. And I think that's really cool to watch over the course of the week.
And that was similar to what I was going to say. So like the passion for the students when they're experiencing certain parts of like different specialties in medicine, and they come out of it and they're like, I'm going to be a neurosurgeon. Like I learned about it. That's what I'm going to do. And just seeing that energy, it just makes you so happy.
Yeah, absolutely. I concur with each of your answers. The reason that we do this is because of our students. And so with that, we want to thank you all for joining us tonight. A huge thank you to Dr. Rinaldi, Dr. O'Neill, and Dr. Traslini for sharing your expertise and helping us bring these institutes to life. We hope to see many of you on campus this summer for medicine, sports medicine, or women's health, or all three. And I just want to say that a recording of this session will be shared via email for anyone that was not able to make it. But with that, we hope you all have a wonderful evening and hope to see you soon.